I'm originally from Missouri and moved to this area about 37 years ago, I guess. I taught in the Fort Zumwalt School District for 30 years. And then I took another job as a retail manager of Ultimate Defense Range and Training Center. My knees had hurt and they always creaked a lot. You know, you bend over and you hear it snap, crackle, pop, and it seemed like my left knee just started getting worse. It's like a toothache where you can't turn it off. I couldn't take anything during the day, and I'd come home, just be miserable, and go to bed and get up and do the same thing again, and constantly putting ice on my knee. And it just got so bad that I couldn't do what I wanted to do.
We tried bracing, physical therapy, injections, medications, basically bone on bone in the medial compartment of his knee, and we talked about joint replacements at that point.
I was very nervous to get it done. I'd never been overnight in the hospital.
He's a typical patient of ours. You know, we see a lot of knee arthritis. You know, he's a very active guy. He has knee pain, just wants to get it under control. When we're prepping a patient for a total knee replacement, you know, preoperatively, I do a lot of counseling in the office. I talk to them about the actual procedure and what we're going to do. I show them on their x-rays. And we make sure they have a good grasp on what they're going to be doing.
When I woke up and that toothache type pain was gone, I knew I'd done the right thing. I chose Barnes Jewish St. Peter's Hospital because it was close to my house and Dr. McAllister works there, and I had a wonderful experience, and I would recommend it to anybody. The nurses were great. If I had to call, they were there. I mean, they responded just in seconds after I pushed the button and brought me little dishes of sugar-free ice cream.
I trained at Washington University. We hold ourselves to the same standards as they do anywhere else. And a bigger hospital doesn't mean better care, it just means there's more people there. So I think, you know, we have an excellent medical staff that supports us.
Seeing Bill after a total knee replacement is why I do what I do. It's rewarding to see patients do so well, especially when they get back to doing the things that they love, and they're just very active and they're essentially pain-free.
Before the surgery, I feel like my brain was clouded because it hurt so much. It hurt all the time, and I just couldn't think. And I had to take myself away from certain duties. Renewed, I think is the best word for it. That before I couldn't do this because my knee hurt. I couldn't do that because my knee hurt. And there were so many things I couldn't do. Now I feel like I can do anything.
I can't tell you what it feels like to walk into a room, have a 50-year-old patient stand up, walk across, give me a hug and say, "You changed my life."
I would tell people, don't put it off. Don't suffer for a year or 2 years or 3 years. Get it done and take your life back.